Welcome to Legal Eye on Health, your insight into health law, the ultimate podcast for unraveling the legal intricacies of managing a thriving medical practice. Join us for a deep dive into health law, specifically tailored for providers. Hosted by Dr. Katie Gilbert Spear, a seasoned health law attorney and practicing optometrist, as she brings her unique perspective and passion for empowering fellow practitioners. Together, we'll tackle the pressing issues confronting providers daily. Welcome to Legal Eye on Health.
Are you looking for a nutritional supplement to help with your day-to-day vision needs? Look no further than MacuHealth. Recommended by doctors worldwide, MacuHealth offers a full line of products designed to support your vision and eye health. Available through eye care professionals on Amazon.com and directly on our website at MacuHealth.com. Use the code LEGALEYE when ordering directly from MacuHealth for special discounts. MacuHealth, nutrition you can see.
Welcome back, everyone. We're excited to be here with you. Katie and I had a lovely time speaking together. Honestly, what I love the most about this, Katie, is you have taught me so much, and we get going, and I don't even know that we're still talking, and David has to tell us to
shut up.
Yeah, that.
Stop talking.
But last time, I think that where we ended, tell me if I'm wrong, we were talking about patient abandonment, right? Wasn't that the last conversation we had?
Yes. Yep. Mm-hmm.
Okay, so where do we want to start today? A little bit more of that?
Yes. So I think it would be good for us to go through a few cases to discuss when and how the physician-patient relationship is formed. Because we talked last time about how it was formed a little bit and then how to successfully terminate it so that we don't continue on with liability indefinitely. But I think there's some cases that I've found that really highlight some unique aspects of the physician-patient relationship, or when it can be formed.
I love this. And what I love too, as you listen to Katie talk about these cases, they're in all different aspects of healthcare.
Correct.
So
Yep.
Whatever your specialty is,
Right.
This applies to you. It applies to me. I'm an optometrist.
Right.
Katie's an optometrist as well as an attorney. And so I love that the cases are all over the place.
Right.
All
really
right.
Any medical provider.
There you go.
Have patients.
Okay.
So the first one we're going to start with is one regarding a physician who never actually saw the patient in person. So do you think that you can have a relationship if you actually never see the patient in person?
It doesn't seem right that you would.
Seems
but
weird, doesn't it?
Yeah.
Yes.
How would that even happen?
There actually have been court cases before on, anytime if you see a patient, let's say in Walmart, or you talk to them over the phone, or, through text or things like that, that could be considered forming a relationship if you dole out any type of treatment advice. So you got to be really careful. Especially if you've already established a relationship with the patient, if you're giving treatment advice. But if you've never even seen the patient, but you start giving treatment advice over the phone or through email or text or something like that, it could be that you have formed a relationship. So this case is really interesting because the doctor was actually a plastic surgeon who was on call for the emergency room. There was a child that came in who had been bitten by a dog in the face and had a laceration.
Wow.
So there was a physician assistant, a PA at the hospital, and when the patient came in, they irrigated the wound, looked at it, called the on-call plastic surgeon, who said, yeah, I think that you can probably suture it up yourself. And so that's what happened. The plastic surgeon who was on call let the physician assistant suture the wound without sedation. And the court said that it was beyond the time frame that was medically advisable, which resulted in scarring. So the patient was very young, and because of the way it was sutured, it resulted in scarring.
Wow.
So the cosmetic surgeon, the plastic surgeon, was liable, even though they never actually saw the patient in person. But because they were on call, it was deemed their patient, and because they doled out advice, it was deemed, the child was deemed their patient, that a physician-patient relationship had been formed. So you got to be really careful if you're giving treatment advice, even, when you're, they call it the consults, the hallway consults, where you got another doctor who's just, hey, I got a patient like this. What do you think I should do about it?
Yeah.
anytime you're given advice, you always want to couch it in, okay, I don't know everything that's going on with the patient, but based on just this limited amount of information, this is what I would do. But please, take it with a grain of salt,
right,
because I don't know the full patient history. So you got to be really careful about what type of advice you give and when you give it.
So what if I called you and I said on the phone, Katie, what do I do about this specific situation with my patient? But I never wrote in my record that I called you. I really just called you or
Right.
somebody else. I mean, how would they ever know? The only way it's ever going to be found out is if that doctor goes and says, I spoke to Dr. So-and-so
Right.
who said to do this.
Right. So at that point, if you're the one giving advice, you need to document it.
Yep.
You definitely need to document what you said. And especially when you say, hey, don't rely just on my advice, because remember, I'm not there looking at the patient and I don't have the full record in front of me to evaluate it, to really give you great advice. I'm just giving you off the cuff. So if you're giving any type of advice, you need to make sure that you document it yourself.
Okay. I love understanding better. So that talks about when the doctor-patient relationship begins and some of the nuances of that.
Mm-hmm.
What about a situation, let's go to another situation of abandonment, which I think you've got another story about a physical therapist.
Yes. So this would be, this happened actually when the physical therapist quit their job. So the physical
therapist now works for someone else.
Correct.
They don't own the business.
Correct.
Okay.
Correct. So they're an employee of
Okay.
the business, but they have their own patients. Remember, just because you're an employee, you may not, technically own the medical records based on your employment agreement. You may not run the practice or anything. But if you're a medical provider, when you see a patient, the patient is yours.
Right.
So, and you're responsible for the patient. So the physical therapist was working as an employee under an employment agreement. The physical therapist wanted to go to part-time hours and the employer refused. And so the physical therapist turned in, a notice. I think it was like a 30-day notice. But before that 30-day notice was worked out, the physical therapist called in sick for a week and then just abruptly quit. And so the employer actually filed a complaint with the physical therapy board. So not even just a malpractice complaint. Remember, most medical professions are governed by a state board.
Right.
Right? And so you can get even if it's not a malpractice claim, you can get in trouble with your state board.
My goodness.
I mean, I chair the probable cause panel for the Board of Optometry for the state of Florida.
Right.
And I've done it for 5 years, and anybody can file a complaint. It can be a patient, it can be another doctor, it can be anybody. So
but they have to file a complaint.
They have to file a complaint
against a person who has a license.
Has a license in that state. Yes.
Not against an entity.
Correct.
Okay.
It's against the person, against the doctor's license or the medical provider's license. So
A lawsuit as well. So just
yes.
going back to technicalities. So
Yeah.
in the case of even the last case we talked about,
Right.
would that doctor be sued and the hospital in that last case of the dog bite?
Could.
So it could be.
It could be both.
Okay.
Mhm.
All right.
And it could be that there's oftentimes actually when you are in a medical negligence or medical liability case, a lot of times those get brought before the board too. So not only are you in a court case, but usually it's you're brought before your whatever board that your license is regulated under. So,
Okay.
So in this case, the board concluded that the physical therapist actually abandoned the patients by his actions, putting their welfare in danger. So you got to be careful how you terminate, your relationship not only with your patients but with your employer, and making sure that you give your patients enough time. And two, you want to make sure that your patients, a lot of times it comes down to employment agreements and all that stuff, but your patients need to know if you're leaving a practice.
So for someone listening that wants to leave a practice, what would you then advise them to do? I mean, just get an attorney, because every state is different.
Every state is different, unfortunately, and part of that is, it's governed by the employment agreement and what what's stated in that, but then also what does your state say about it? Because just because your employment agreement has it in there, it may be that doesn't align with whatever the state statute or state rules are too. So
Right.
I would advise getting an attorney and making sure that you do it the right way.
So as an employee, that makes me think of something else, Katie.
Mm-hmm.
What is your, let's talk malpractice for a minute. So that person who left,
Right.
we're not talking about them having done anything necessarily to a patient, but
Right.
should they carry coverage, malpractice coverage, even after they leave?
Yes, you have tail coverage. So you're going to cover whatever patient that you've ever seen.
Because you can still get sued
Yes,
when
you
you're
can.
at another practice.
Yes, you can. So usually you have tail coverage that covers you after you leave a certain practice.
And you need to pay for that yourself, not count on your employer.
Well, it depends. So usually that's, I mean, well, not all the times, but sometimes that is covered in the employment agreement.
Okay.
So, but that's something you need to consider when you actually sign the employment agreement.
Right.
Of, okay, wait, if I ever leave here,
Yeah.
how am I going to have malpractice after I leave here? So it's a very important consideration. Yeah.
All right, so I know I asked a bunch of questions, but basically in this case, the board concluded that the physical therapist was...
He abandoned the patients. And so, there wasn't maybe, and he put the patient's welfare in jeopardy. It doesn't mean that there was any damages to the patients. It's not a malpractice case.
Right.
But you can get in trouble with your board if you don't do things the right way. It's kind
So
of
just
ethical.
between you and me,
Yeah.
what did the employer have to gain by doing this?
I don't know.
I mean, maybe get the person to
Just
come
mad.
back and work, or they were just upset.
Upset that you did something the wrong way.
And honestly, that's how many cases come to the board, don't they?
Many cases. Patients are just upset about anything,
Right.
And some things it's trivial and you're like, okay, this is not right. And then sometimes it is something that actually, it matters,
Right.
It
Wow.
runs the gamut.
Okay, well, let's talk about those disgruntled patients. That leads us right
You have
into another
disgruntled
case.
patients? What?
I hope not. Well, it happens. It happens, yeah. I mean, Allie and I talked about this the other day. We were talking together, and I said, honey, sometimes, many times, and I actually wrote an article about it, it's not the fact that you did something, because very rarely do we do anything wrong. It's that you have a patient that's upset.
Right.
And many times they're not even upset with us. They're upset about something going on in their life. And instead of me getting upset about it or about them being upset, what I've really tried to do over the years is just understand that I don't know their situation.
Right.
And wouldn't it be amazing if I could be the one that would turn it around for them, so when they leave a happier, better person.
Right.
Anyway, back to the disgruntled patients. So what about a situation where you have a disgruntled patient? Do you have a case?
I do have a case. So this is a case with an OB patient who had surgery for cervical dysplasia. 2 weeks later, she went to the emergency room with abdominal pain. She was diagnosed with an infection, given some antibiotics, and told to follow up with her OB, which she did. She had an appointment the next day with not the obstetrician that actually performed the surgery, but with the obstetrician's partner. And everything was normal. She was told to return in a month or sooner if symptoms returned. She actually went back to the ER the next week and was told to follow up with her OB, so she called her OB's office trying to get another appointment, and she demanded at that point, not that she did not want to see the partner, she wanted to see her doctor who actually performed the surgery.
Right.
And she was told that obstetrician did not have any appointments, or that physician had no appointments for several weeks, but that she could see the partner. She was really angry with the office, and because of her behavior, they terminated their relationship. Yes. Sent her, now they did send a certified letter, which is good. That's what we talked about, is sending the certified letter, making sure that you give them a proper amount of time. I think they gave her 15 days in this specific case for any emergencies. But, and once she got that, she called the office and threatened to sue them. And, but she didn't get an appointment. So she went to another physician and at a different practice and was diagnosed with cervical occlusion and underwent a hysterectomy. And so she filed a lawsuit for patient abandonment against the original physician who did her surgery. And so a couple of things here. We all have disgruntled patients. I don't know that there's a day that goes by that I don't have at least one disgruntled patient at some level in one of my practices, right? We deal with them. And like you said, I think a lot of times patients are just upset about something else going on in their life and they're taking that on you.
Yeah.
In this case, I think that, I would want to go back to the physician who actually performed my surgery, because you did my surgery.
Right.
So the fact that you're so overloaded with patients that you can't get your surgical patient in, that seems like a problem, and so I can see why she would get upset. Maybe she took it the wrong way, maybe she just went overboard with the demands or the complaint.
Right.
But I think at that point, you as the physician, as the doctor or the provider, you need to get the patient in.
Take an extra 10 minutes.
Exactly, and say, you know what, it is not worth all of this, because, oh my gosh, look what this led into. If I'd just seen the patient and said, nope, you're good, or hey, here's some antibiotics, or you're gonna be fine, versus this. And so I just think, especially in the middle of a post-operative care.
Wow.
So really consider the patient where they are in the treatment program before you terminate.
It's just not worth it.
It is not worth it.
If you go back and think about all the times that we've had challenges like that,
right?
I definitely have had moments where I'm like, why do I have to deal with this? And yet as soon as I do, everything's better.
Yeah, just get it over with.
I have not once had one that we've not been able to calm down and clear the misunderstanding. Not one.
Oh, I have. I've had to fire patients, but still. And that's okay. That's okay. We do it the right way.
Exactly.
At the right time.
We've talked about that. And if we haven't talked about it enough, we will.
Yes. If you got questions, send them in.
So I think there's one more thing that we hinted that we would talk about in an upcoming episode. So let's try to hit it now. Are you ready?
Sure. Yeah.
So what about screenings? I know in the world of eyeballs, I've done vision screenings, and my state board has very specific rules that I follow. Mm-hmm. But tell us about screenings. Is there a story? Is there a case? What would you tell us to think about?
Yeah, so I think with screenings, they're great. And I mean, I think they're really good if you're trying to build your practice. It's really good for your community, but there may be some liability that follows that. So you have to be really careful. There have been a couple of times, and I'm sure probably more, but just specific cases that I've seen where, the doctor was performing an exam on a patient for like an employment position.
Oh, yeah.
And, the doctor has a relationship with the employer, and they're performing a physical exam on, a patient, but they're not forming a doctor-patient relationship because it's basically a screening physical for employment. There's been a couple of cases where the doctor, even though they didn't form an actual relationship with the patient, because the doctor didn't disclose certain findings from the exam, they were held liable for that. Mm. In one case, they had some x-rays done, and the patient had possible presence of Hodgkin's disease, and they didn't disclose it to the patient, and so they were held liable, even though, and the court said, there was no doctor-patient relationship formed, but you should have told the patient of the findings. So my thought is, for screenings, first you need to check your state law, because like you said, depending on your profession, there may be statutes or rules governing what you need to do in screenings. Yep. Make sure you have the right malpractice coverage that will cover you for screenings.
Good point.
Yes. And then discuss what the process is going to look like with whoever's running the screenings. Make sure that you have the adequate space, you've got the adequate support staff, whatever you need. And then make sure you have an informed consent. There needs to be a different one for adults and children, and that you specify in that one that that's not a complete exam. We're not checking for everything. Like in the world of eye care, it's not a comprehensive exam. But that there's no doctor-patient relationship that's being formed. So
and then give them the results.
Yes, and give them the results. Whatever you find. No, that's what the purpose of the screening is. Give them the results. So
I love that. Advice. That's good. So we've covered a lot. Yeah. I love that. For those of you who haven't listened to prior episodes, go back and listen to those. It's not like this is part 2 or part 3.
No. Yeah,
they're all independent, but they're all extremely important. And I think that just hearing all the stories helps you to just think different. So Katie, thank you so much for doing this.
No, thank you.